Hello. Today, I'd like to discuss situations in which it is difficult to distinguish thyroid lesions from parathyroid lesions on ultrasound. Among these three cases, which represent thyroid lesions and which represent parathyroid lesions, the location of the lesion is here. In the first case, during a thyroid ultrasound at an outside hospital, this lesion was suspected to be a possible parathyroid lesion, and the patient was referred to a tertiary hospital. At our institution, a parathyroid scan showed no abnormal findings, and the parathyroid hormone PTH level was normal. In the second case, during a thyroid ultrasound at an outside clinic, this lesion was suspected to be a possible parathyroid lesion, and the patient was referred after undergoing fine needle aspiration. Let's look at the ultrasound video performed at our institution. First, this is the transverse view, followed by images obtained while changing the probe angle. The FNA slides from the outside clinic were reinterpreted at our institution and were diagnosed as showing atypical cells. In this patient as well, the parathyroid scan performed at our institution showed no abnormal findings, and the PTH level was normal. When performing thyroid ultrasound, it is not uncommon to mistake thyroid tissue located posterior to the septum for a parathyroid lesion. In such cases, rotating the ultrasound probe in multiple directions during the examination can be very helpful for diagnosis. Even if cytology shows a result of atypical cells, this does not necessarily indicate a thyroid nodule. As you can see, atypical cells can also be reported in cases of thyroiditis. When a parathyroid lesion is sampled by cytology, it is often not diagnosed as a parathyroid lesion. Instead, results corresponding to various thyroid lesions may be reported. If a parathyroid lesion is suspected, it is preferable to avoid FNA if possible. However, if FNA is performed, cytology alone is insufficient, and the PTH level in the needle washout must be measured. In the third case, this patient had hyperparathyroidism and was referred from an outside clinic where ultrasound was reported as normal. On ultrasound, a hypoechoic lesion is seen posterior to the right thyroid gland. At first glance, it might be mistaken for thyroid tissue posterior to the septum, as in the previous cases. Let's review the transverse and longitudinal ultrasound videos. On real-time ultrasound, it is clear that this is not thyroid tissue behind the septum but a focal lesion exerting a mass effect. On the parathyroid scan, there was uptake at the same location where the abnormality was seen on ultrasound. Among the three cases, the parathyroid lesion is the third case. To differentiate thyroid and parathyroid lesions on ultrasound, if a lesion posterior to the septum is suspected, rotating the ultrasound probe in various directions and applying different degrees of compression can be helpful. If a parathyroid lesion is suspected, PTH testing should be performed first rather than FNA. If cytology has been performed, the results must be interpreted with a clear understanding of these limitations. Thank you.